Joining me to talk about treating our pets as if they do develop the disease is Dr. Ann Hohenhaus from the Animal Medical Center in New York City.
Hi, Nicole. How are you?
I am doing great. Now, what are the signs and symptoms for our pets when they do develop the disease?
Well, Ralph here, who's diabetic, has one of the signs of diabetes, and you can see he's kind of thin and bony over the back. So weight loss is a sign of diabetes in both dogs and cats. One sign that's unique to the cat is sometimes you'll see them walking on this part of their foot here. They'll be down in their back leg like this. He's just being squirmy. And if your cat's walking down in its back leg, that's another unique cat sign of diabetes. Dogs and cats also will drink a lot of water and urinate a lot, which owners might recognize as accidents in the house or a very wet litter box compared to normal.
Well, then how is diabetes diagnosed in the animals?
Well, we do a blood test in our dog and cat patients to determine if their blood sugar is high, and we also can test their blood or their urine for ketones, just like a human diabetic would.
How do these owners, when they have a pet that's diagnosed with diabetes, how do they treat the condition?
Some cats will respond to the oral anti-hyperglycemic agents like glipizide, and so the cat can take a pill. Sometimes you can correct diabetes in a cat if you get it to lose weight, just like type 2 diabetes in adults. In dogs, if you have a female dog, she might develop diabetes when she's in heat, and so spaying her might help it. But the vast majority of dogs and cats ultimately need to be managed with insulin treatments, insulin injections, just like people with diabetes get too.
So how do owners test their blood sugar and then give them their medications?
Dogs and cats don't live nearly as long as people do, and they don't develop the kidney and eye problems and the foot problems that our human diabetic patients do. So we don't worry about as tight glucose control in our dogs and cats as you do in people with diabetes. So we do a very crude method of controlling their blood sugar. If the cat or dog is not drinking excessively and urinating excessively, and that's a good sign for us, and we can monitor the glucose in their urine by urine dipsticks, and that gives us a rough estimate of what the glucose is, and that's good enough for them.
What is the normal range of blood glucose for these animals?
The normal range of blood glucose is going to be about the same for people, somewhere around 70 to 120. But we don't try and keep it that low because a little bit lower in an animal and then they're having a hypoglycemic problem. And so it's better for our patients to be a little hyperglycemic because, rather than having a hypoglycemic attack, because they can't tell us that they're not feeling well and their blood sugar's low.
Now, how do people give their animals insulin injections?
We use the same syringes that human diabetics use. I tell my clients to put their hand on the back of their animal, and that's the area where you want to give an insulin injection.
That's got to be so difficult.
It's not. I had a diabetic cat for years, and I would put his breakfast down, and when he was busy eating, I would sneak up, give him his insulin, and move on to my next task of the day.
What other advice do you have for owners?
When you have a diabetic pet, you have to be prepared to manage your life around the pet's needs a lot more than a traditional or a healthy pet. And so you have to be available to give that insulin injection twice a day at approximately 12-hour intervals, and that puts a little bit of a restriction on your life, but that's what you need to do to manage one of these pets.
And of course, we all love our pets so much that that's not an imposition at all. Thank you so much, Dr. Hohenhaus.
You're welcome.
And thank you for the folks from BitoWe for bringing these wonderful pets to join us here on the set.